On the screen you see right now is Kelsey Bero. Kelsey, explain to everybody who you are and what you do.
Hi, everyone. So I am a licensed professional counselor, which is a fancy way of saying I am a therapist. I work through an outpatient clinic in Pittsburgh, working with adolescents that have severe depression and anxiety.
How long have you been doing this?
That's a great question. The particular clinic I've been with since 2017. So I guess about a little over 4 years. And then before that, I was in graduate school and also worked on an inpatient unit at Western Sykes Hospital, working with adults.
So give them an idea of what education you have to be a licensed therapist.
Yeah, absolutely. So it is a little bit of a process. So I first went and got my undergraduate degree at the University of Pittsburgh. I majored in psychology and minored in neuroscience, but you can pretty much major in whatever you want in undergraduate and still apply to master programs to train as a therapist. So I had other people in my graduate courses that had majors in biology, English. I think one of my peers also had an undergraduate degree in business, but they had taken additional coursework. There's some required classes you have to take to get into that master's program. The master's program I attended was at Chatham University, and it was 2 years, I want to say 5 semesters of coursework. And that also included a year-long internship where I practiced, I was doing therapy, but I was under direct supervision of other clinicians and licensed therapists. And then I graduated from Chatham. So at that point, I was a therapist, but not yet a licensed therapist. Then I had to do another 2 years of supervised therapy. So I was doing assessments for new patients, running group therapy, and working with teams one-on-one. And after 2 years and an exam, and I think I had to do a couple continuing education courses. Then I applied with the state and was then licensed. So I've actually been a licensed therapist for about 1.5 years now. So I was able to do the work for a while, but I'm kind of at the final stage where I'm now a fully licensed therapist.
This is my question. This isn't yours. So when I was a therapist 23 years ago, when I was doing child and adolescent, my only qualification was I had a master's degree in education. Mm-hmm. Is that the same thing now? And then I could actually get my 2 years to get my license certification?
It's a great question. So there are.
I'm asking for me. I don't care about them. I'm looking for a new job.
Gotcha. Yes and no. You probably could, but there are specific course requirements with the state. So you would have to see if your master coursework fulfilled those requirements, or you'd have to go back, take a couple more classes to fulfill those courses, take the examination, and then you probably could.
It seems to me that the states have tightened up regulations because 20, 25 years ago, not only was I doing it, your aunt was also doing it too. So I find that interesting.
Yeah. Yeah, so to have the title as a professional or a licensed therapist, there are specific boxes you have to check. There are roles of being a quote unquote therapist that don't necessarily require being licensed or even going through a master's program. So examples would be some of our intensive outpatient programs. So they're multiple days a week. We have teens and there's adult programs too that come in and receive group therapy. So it's a lot of like skill training. Sometimes we have bachelor level clinicians. So they are getting a lot of supervision. They're working directly under a master's level clinician. So there are routes to go where you're doing therapy, but you don't necessarily have to go through of school.
So one thing I want to know, since these guys are in 11th grade, where were you in 11th grade? And did you think about doing this when you were in 11th grade?
Yeah, I love this question. Absolutely not. So it's funny, actually, when I was in 11th grade, so I went to Brownsville High School, and I had a wonderful anatomy teacher. And I remember going through each body systems, and I absolutely hated learning about the brain. I was like, I really liked things to make sense and be black and white. And I remember one day she taught us a lesson and she was like, and then we really don't know how things work after that. And I was like, that's terrible. So I actually thought I was going to go, I knew I wanted to go into healthcare, but I was interested in medicine, particularly like the digestive system was interesting to me for whatever reason. So when I went into Pitt my first year, I was actually, I think I was a neuroscience major. So I was taking a lot of biology and chemistry courses, and I didn't love it. I actually hated it and was feeling like pretty discouraged myself because I was like, great, I got a year of college in. What do I do now? Just by chance that summer, I was taking some coursework at Pitt to try and get ahead of credits. So I took 2 courses and I saw a course called cognitive psychology that looked kind of interesting to me. There's limited choices for the summer, so for whatever reason, it stuck out to me. And it was in that class that I started to be really interested in the brain. So cognitive psychology is all about how we perceive our environment around us and how that impacts our thoughts. So what thoughts we have based on our environment around us, because every single one of you are, you're sitting in class, you're listening to me right now, but you're all actually having different thoughts. So even though you have the same experience, you're having different thoughts right now. They might be similar, but you're going to take away.
This sounds familiar. Anyhow.
So anyway, to not ramble on too much.
No, you're okay.
That course inspired me to take more psychology courses. And one of those was abnormal psychology. So that is learning about different psychiatric illness and diagnosis. And then I also started working at Western Psychs Hospital and talked with a lot of the other providers there, psychiatrists, nurses, therapists, and they helped guide me in figuring out what was it about this field that I specifically wanted to do. And then that's what led me to pursue therapy.
Now, you said you wanted to go into the medical profession or healthcare somewhere.
Mm-hmm.
Why is that?
Yeah, great question. So part of influence would definitely be my family. Pretty much all of my family, except my one sister, who's a teacher, everyone's in the healthcare field. My dad works at a hospital, my mom's a nurse, and then my other sister's in pharmacy school at the time. So I did have a lot of knowledge of the healthcare field. I also really liked math and science, but more specifically, I really liked problem solving, like being curious about something and wanting to figure out how to find a solution that works. So you could apply that to a lot of different careers. I know some of my peers throughout grad school also were really interested in like forensics and detective work. And as silly as it sounds, healthcare and medical professions, therapists, and detectives have kind of a similar trait here because we're really being curious and wanting to find understanding. And I always found that in different activities and classes that I liked, they were usually classes where you had this ability to be curious and be creative in how you figure out how to react or move forward.
So now that you're doing this job, what are some of the skills other than the education did you need to go into this line of work?
Yes, wonderful question. My first skill that I recommend for anyone who's interested in healthcare, period, whether that's more the medical route or psychiatry and mental health, is being able to take care of yourself first. There's this saying, you can't pour from an empty cup, meaning like you can't help others if you don't help yourself first. And there's a lot of talk about something called burnout in the healthcare field, which is like we're constantly trying to help others that sometimes we forget to take care of ourselves. So I would 100%, like if you want to go into healthcare, first start focusing on how you can take good care of yourself, physically, mentally, emotionally. Additionally, I do think it takes willingness to work with other people, and not only work with other people, but work with other people that might have viewpoints, perspectives, opinions, or even just lifestyles that are really different from your own. So it takes a sort of patience and understanding that someone might see something completely different than you do, and that's not necessarily wrong or bad. It's sometimes frustrating, and it's part of that problem solving curiosity and creativity that I love about my job, is working with other people that see and approach things differently than I do.
So when you're sitting with a client, now you are doing one-on-one, you're not doing group, or you do both?
I do both. Right now, most of my job is one-on-one therapy.
I've been talking to these guys in all my other classes, the importance of being able to listen to more than just the words.
Mhm.
When you do what you do you get information? Do you get most or all of your information from what they're saying, or do you get your information about how they're saying it?
It's definitely the full experience of the interaction. It does take, I don't know the right word for it, but maybe willingness to sit and be present in the moment with someone and really be able to be mindful of what's going on in the relationship with the other person, even with myself. There's a lot of different things you're attending to in that moment. But for example, like in my appointments, I could think of yesterday specifically. It was a pretty busy day at the clinic. I was seeing a lot of people. I had a lot going on, but when I'm meeting with someone, phone's away, my phone goes directly to voicemail. So it is listening, not necessarily to respond or listening to have a right answer. Because sometimes I work with people and I say, like, I don't have an answer for you. They'll be like, tell me what to do. And I'm like, I don't know, I'm not you. Like, let's try to be curious and listen a little bit more. What's going on with your emotions? How do you feel physically as you're talking to me about this? What are the actual words and language that you're using? So I would say it's all of the above, including my own reaction too. If somebody's telling me something and I notice I start to feel nervous or sad, that's just as an important piece of the conversation.
So how old are the clients that you're working with?
Generally, I work with clients 12 to 18. Occasionally, I'll see patients under 12 And then we do have a college program. I don't do a ton with it because I prefer working with adolescents, but sometimes I'll have some college clients as well.
How do you need to relate to the client?
Not necessarily. I think generally I'm going to relate because I'm a human first and a therapist second. So I don't necessarily have to have a similar experience. Sometimes I do, but I never pretend or act like I could know exactly what my client is going through. But I do often self-disclose my own skill use. If they're using a skill, I might say like, oh, here's the time I used it. And yeah, it's really hard to try something new. Or yeah, when we're feeling really angry, I know I sometimes feel really tense. Like, what's that like for you? So I think being able to relate is important, but it's not always a necessity.
Because I was going to ask you, how do you relate? Because you are mid-20s right now, right?
Yep,
Yep.
28.
28. Yeah, I can't believe that. Anyways, you were 28, and how is it working with a 12-year-old when you haven't been 12 for so many years?
Yeah, this is actually funny. So I was running one of our groups on Monday. I was covering the group, and someone said something, and I brought up like a TikTok sound, and then someone was saying the emotion jealousy, and I was like, oh, that reminds me of the Olivia Rodrigo song, and I was like, I'm just gonna stop because I'm trying too hard to be young here. So I would say like my teens keep me young. Like, sure, we talk about the hard stuff, but we also like I hear what's going on, what's happening in the adolescent world. So I don't know. There's definitely challenges, but I find I find there's also advantages too, because sometimes things that are keeping my teens going are things that I've been able to experience, like college or buying a house or having a pet. Like sometimes that's what they're looking forward to in life. So it can be helpful to have someone to talk to that's done those things.
Well, at least some of the stuff you're listening to is coming back around since you were at the Jonas Brothers concert last week.
I was not a huge Joe Bro fan, but I do try to keep up with what's happening in the adolescent world. Both as a professional, I feel like it's part of my professional duties. And also,
Because trust me, there was a 14-year-old that was disappointed that she wasn't able to go.
yeah.
But so when you got into this, and I know it's difficult to remember your first patient, first client.
I remember her.
Really? What stands out about her?
That's a good question. I think what stands out early on, I think the reason I remember a lot of my early patients is because I was new to it. I had done a lot of observing, but I had really, really close guidance and supervision.
Okay.
So I think what stands out for me is initially reflecting back is I think like, wow, I've grown a lot since then. But I guess thinking about how real the therapy process is. I think sometimes it can be taboo, or there can be stereotypes about seeing a therapist or meeting with a therapist, but thinking back to that, it's like, wow, like that was really real, and it was really helping someone who wanted to better their life and their experience and how they interact with the world. So yeah, I don't know if that completely answers it, but that definitely sticks out. It's just kind of wild, the journey.
One of the things, and I've thought about this because I look at education this way now, is you were a therapist prior to COVID.
Mm-hmm.
You went through a lot of changes through COVID.
Mm-hmm.
But the one question I have, do you feel that because of COVID and because of the isolations that people dealt with, do you feel that therapy has become much more accepted than it was prior? Because like you just said, it was taboo.
I definitely see, not just with COVID, but with a lot of stressful events and things that are happening in our world, that therapy is talked about more. And I feel like this has been a gradual progression that I've seen even when I started working at the hospital back in, I think that was like 2013. So I do think COVID has helped that, because it's been this shared, dare I say, traumatic experience that we've all experienced together, and recognize the difficult emotions that have come with that, both of loss, of sadness, of missed events and opportunities, and just a complete change in lifestyle, that I think because we're all can relate to that because of this shared experience with COVID, it's easier to say, yeah, I need help with that.
How about telemedicine and doing it via what we're doing right here via Zoom, via Google Meets, whatever it may be? Do you like doing it that way, or would you rather be in the room with the people?
Yes. So we've had a ton of discussion about this at our clinic. Personally, I prefer to be in the room with someone, but there is a real advantage to telehealth. The two things that stick out, our clinic specifically, we were able to reach a large geographic area through telemedicine. So this past year, I've treated people from Canada, New Hampshire, South Carolina, like just people all over that might not have access to the intensive services that we have at our clinic.
Now, what I find interesting about that, you are based in Pittsburgh.
Mhm.
Okay.
Yeah.
Why are these people from outside the region coming to your clinic and not going to one of their local ones?
Yeah, it's a great question. So I will say part of what allowed that to happen were there were waivers that extended and allowed my license to apply in other states.
Okay.
So I will put that out there. But the reason why, I mean, I don't want to act like we're so great, but our clinic is actually very, we do a lot of research, and our clinic was actually founded 35 years ago by Dr. David Brent, and he's pretty much the psychiatrist that has found effective treatment for adolescents with depression and adolescents that are dealing with suicidal ideation. So pretty much if you look up any research article on adolescent depression, you're going to see his name either in the publication or in the works cited section. He's kind of, the guy. So a lot of people come to us if maybe their local providers are, struggling to provide the level of care or specialty, or really just noticing some resistant or persisting symptoms of their depression.
Are the other providers referring to you now?
Yeah, I mean, we do get a lot of referrals from all over. We do consultation if they're not necessarily able to do full treatment at our clinic.
When you did or do telehealth, do you do it in your home or do you do it at your office?
Most of the time I am at my office lately. For most of the pandemic, I was at home. But more recently, we were able to really easily be vaccinated and have established some safety protocols at our location. So most of us have been going back in. So I would say 80% of the time I'm in the office. This is actually the first time I'm in my home today, and I'm going into the office a little later. We've also switched probably 30% of our services back in person just about 2 weeks ago. So there's kind of a a hybrid approach we have, and we feel that will probably be the future of therapy, will be a hybrid approach, that there will be more providers that will offer telemedicine because of the greater reach we're able to have.
Do you feel that you have a different therapy style at home than you do at the office?
Um, I never thought about that. I actually don't. I don't think my kind of therapeutic presence is different. I will say my productivity is different. I have a little bit more of a tech heavy setup at work, where it's a little bit easier for me to answer emails and take calls and do my documentation, that kind of boring part of the job.
So do any of you guys have any questions? Yeah, go ahead, Sarai.
So you said you work with like teenagers with depression and anxiety. Listening to all of their stories and stuff and like working with multiple, does it ever like take a negative toll on you when you get home?
Yes, absolutely. That is one of the most difficult parts of my job. While it's a pretty heavy job, because specifically our clinic, it's teens with severe depression. So pretty much everyone on my caseload is meeting criteria for a severe depressive episode. So it's heavy. And it kind of loops back to that part of self-care that I had mentioned before. So I found things that really work for me. When I'm at home, I always do therapy in my office, or I'm in the actual clinic and do therapy there. That way I can physically walk away from my work at the end of the day. Additionally, I don't take any crisis calls after hours. We have something called Resolve Crisis Network in Allegheny County that takes our crisis calls for us. So once I leave work there. But that's not to say that there are people that I'm worried about and I take home with me at the end of the day. So usually that I've learned within our clinic, I reach out to one of my colleagues, one of the other therapists, and worry out loud about whoever it is I'm worried about. We often also are including parents, sometimes even schools, pediatricians in our treatment. That way, really take this kind of worry together approach, and not one person has to carry the weight of that.
Last week, when we talked to labor and delivery nurse, she said that her roommate is also a nurse and she's able to talk to him about his day, and his day is usually worse than her day. Are you able to do that with your husband, who's a financial planner?
Yes and no. I will say when I was at home 100% of the time, often I was unloading some of my stress onto him, and we learned for our relationship that wasn't actually very helpful. For one, he really didn't understand the work I do, and he does understand it a bit more now. But I found that I wasn't feeling that same kind of validation of my worry or stress from him because he hasn't experienced that. So I've definitely learned that while I can tell him how my day is, I'm not going to him and sharing specifics.
Okay.
Additionally, there's confidentiality.
Right.
So I'm never saying anything specific about my patients with my husband. It's usually, again, my treatment team, my clinic staff that I'm going to turn to and worry out loud about.
Anybody else? Any questions? Gosh, you guys are quiet. Is there any type of topic or situation that you feel uncomfortable with when dealing with a client?
Yeah. You mean like an issue that a teen might be
Yes.
dealing with?
What you said is and as Zariah said, you're dealing with something very, I hate using this term, but something very heavy.
Mhm.
Has there ever been a situation where you're in the room where the individual says something to you that you've never heard before, and you don't know how to react, because as you said earlier, you give a facial expression, you give an uneasy feeling. Is there something that is beyond your wheelhouse when it comes to that?
Mhm. Um, that's a really good question. I will say, like, I do specialize. Most of our clinicians do. So at our clinic, we see a lot of people with primary depression and anxiety. And then my teens also, like, if they have additional things going on, because we know these things don't always just happen by themselves. Um, I tend to take teens that are also dealing with social anxiety and eating disorders. Those are kind of my like side specialty, so
Okay,
to speak. So if someone does come with me and they're dealing with maybe substance use, for example, it's not like shocking to me. I don't like panic. Um, it's like, okay, like let's figure out who we can get you to talk to about that. Like, do we need to switch the type of treatment, the provider? Is there something that I need to learn more about so I can be helpful for you? I would say it's pretty rare that we hear something completely like outlandish or we haven't heard of. I would say like most people and their struggles, while they are certainly unique, they're usually not alone with whatever it is that they're dealing with. So it might just be that I learn more about it and figure out like, is this something I can be helpful
okay.
with, or is it something that I can help you find someone who specializes or has more experience in that?
Have you ever had the individual come in who was referred because of a situation that may have happened, who basically does not respond to treatment?
Mhm. Yeah, yeah, that certainly does happen. So the treatment that we do at our clinic is something called evidence-based treatment. And I would encourage you all, if you go into a healthcare field, you want to be doing evidence-based treatment, which means that the treatment we provide has been well researched to help with the diagnosis that the person in front of us has. So for me, I'm trained in cognitive behavioral therapy and dialectical behavioral therapy. So those are my approaches, and they are the kind of gold standard or most likely to be effective
Okay.
for adolescent depression and anxiety. But yeah, sometimes we don't see the symptoms going away like we want them to, but that doesn't mean we're out of options. It just means we have to kind of go to the next option. Usually it's maybe medication or a change in medication. There are other types of therapy out there that are helpful for others, not only different types of therapy, but different levels of care. So sometimes I'll bump up and see someone twice a week, or we'll refer them to something called an intensive outpatient or partial hospitalization program where they're going to therapy 3 to 5 days a week. So that does happen sometimes, and it's not necessarily a bad thing. It's just kind of a response to the course of treatment or the course of the illness.
You just said something there that just made something pop in my mind, because you are dealing with such a large area. Is there ever a language barrier that gets in the middle of this that may make it difficult? How do you
Absolutely.
deal with that?
Yeah, yeah. So in Pittsburgh, we do have um, patients that are speak many different languages. We're fortunate through we're UPMC clinics, so we have translators that can join, and then we do also have kind of a good networking of providers in the Pittsburgh area that could do therapy in a different language, because we know that therapy in the person's primary or native language is most effective. We're also really fortunate that one of our psychiatrists at our sister clinic, he works on the same floor as us, is his native language is in Spanish, so that's pretty helpful as well.
Do you ever have a problem with stuff being lost in translation?
Yeah, it definitely is a challenge, usually with our teens, because of school setting, they do also speak good English. It's usually with the parents that we struggle a little bit more. So it can be tricky, and we know that it's important to not use a family as an interpreter, because we don't know if that family member might have their own agenda or their own bias. So we always use kind of a third party, like a outsider, as the interpreter, in hopes that we can not have anything lost or kind of skewed in that translation.
Before I let you go, is there anything that you want to tell these guys about going into this field?
Yeah, I mean, my biggest thing is remembering that we all have mental health, and if you want to be helpful to someone else with their mental health, you got to take care of your own first. The same as if, you know, your pediatrician also has their own doctor. So I've done my own therapy. Like, it's really important that you take care of yourself. That way you can be successful in the mental health care field, but in really any field that you choose. You know, when we're happy and healthy, then, you know, we can help other people get there as well. And it's extremely rewarding.
Well, Kelsey, thank you very much. I really appreciate you taking time before work today to do this for us.
Absolutely. And if anyone has questions that they didn't want to ask in front of the class or what have you, feel free to ask Mr. Nuttall, and he knows how to get a hold of me. It was great talking to you all. Thanks for listening.